costovertebral joint. Costo means it is nothing but the rib. Costo means is rib. Vertebra means we know thoracic vertebra. So here while coming to discuss this costovertebral, first this joint is a synovial joint. Synovial means it is a diarthrosis joint. Diarthrosis joint, that means freely movable joint. It is a freely movable joint. Okay. Here now we'll come to the point. Here I am dividing it into two. Second rib to ninth rib. Second rib to ninth rib, and here first rib, 10th, 11th and 12th ribs. So I am dividing second 9 ribs in one place. First to 12 ribs in first 10, 11, 12 one place. Suppose here if we come to costovertebral joint. Suppose if we take a rib, so imagine this is the head of the rib. This is the head of the rib. This head portion is going to articulate with the vertebra. Okay. So here see the point. Suppose imagine this is T3, this is T4. Imagine T3 and T4. This second to ninth ribs are called as the typical ribs. Here, typical ribs in the costovertebral joint. What it means? Here, if we see the rib, imagine this one rib. Okay, imagine this one rib. So, if you see the head of the rib, here we will be having two articular facets. We will be having two articular facets. Okay, two articular facets. These two articular facets are separated by a ridge. That ridge is called as the crest of the head. Crest of the head of the rib. Okay, crest of the head of the rib. So a ridge will be present between the two articular facets of the head of the rib. So here costovertebral joint means it is the joint of head of the rib and adjacent two vertebrae. At the same time, here in the middle of the vertebrae will be having intervertebral disc. So costovertebral joint is the articulation between the head of the rib, at the same time two adjacent vertebrae to that rib. At the same time IVDP. So here this is the superior articular facet of the rib. This is inferior articular facet of the rib. So superior, inferior, two articular facets are there. So that's why the head of the rib here we will tell it as demi-facet. Demi means two, facet means articulating faces. Okay, so this is the demi-facet articulating surface. So that here the superior portion will articulate with this superior vertebra, inferior portion will articulate with the inferior vertebra. So here we will be having articulating surfaces for the rib. Here in the rib, in the body of the vertebrae, here we will be having articulating faces for the rib. Suppose this is our superior vertebra, this is inferior vertebra. See here the inferior vertebra and superior vertebra. Here the superior vertebra, here it is having, superior vertebra is having articulating facet for the superior articular surface inferior. Understand the point? Here superior vertebra is having articulating facet for the superior articulating facet of the rib at the inferior portion of the superior vertebra. Inferior vertebra is having articulation facet for the inferior articulating facet of the head of the rib at superior. So this is the costovertebral joint from 2nd to 9th ribs. And now if you see first, 10th, 11th, 12th, these ribs are the atypical. These ribs are here atypical. Here these joints, especially these joints are atypical joints. What it means? Here if you see the rib, it is going to articulate with the two vertebrae. But here if you see here, suppose one vertebra is there, the rib which is present here, the head of the rib will be having one, the head of the rib is going to articulate with the only with one corresponding vertebra, only with one corresponding vertebra. So that's the only difference. Here 2nd to 9th, these ribs are going to articulate with the two adjacent vertebrae. First to 10, 11, 12, these ribs are going to articulate with the adjacent only one vertebra. So this is about the costovertebral joints. And next point about this costovertebral joint. Suppose here if you see this is one vertebra and here we will be having one more vertebra. The head of the rib will be like this. It is going to articulate with this vertebra and this vertebra. Superiorly one vertebra, inferiorly one vertebra. So here we will be having two articular facets, nothing but the demi-facet. In the middle, these two articular facets are separated by a ridge called the crest of the head of the rib. So from here, crest of the head of the rib, here we will be having one ligament. Here we will be having one ligament. Here we will be having one ligament. That ligament is interosseous ligament, or also called as the intra-articular ligament. So that the ligament which is present here, this is going to divide the costovertebral joint into two portions. First one superior portion and second one inferior portion. So because of which ligament, intra-articular ligament, also called as the interosseous ligament. Interosseous means it is inside, interosseous, and intra-articular, it is nothing but it is present between the articular surfaces. So that's why intra-articular ligament. So here the point is, in this costovertebral joint 2nd to 9th ribs, here we will be having interosseous ligament, or also called as intra-articular ligament. It is going to divide the joint into superior portion and inferior portion. And at the same time, here we will saw one ligament, intra-articular ligament. One more ligament will be there, that is the radiate ligament. How that radiate ligament will be how the radiate ligament will be. See here, suppose this one vertebra and here one more vertebra, this one more vertebra. So if we see, imagine this is our thoracic spine. Imagine this is our thoracic spine. Okay, this is also thoracic spine. So here we'll be having a rib. From here we'll get one rib. This is our rib. Okay, this is our rib. So this radiate ligament will be having three connections. First one, superior connection, and then middle connection, and then inferior connection. And we are speaking about the ligaments of the costovertebral joint. First ligament, intra-articular ligament, also called as the interosseous ligament. Second one, radiate ligament. This radiate ligament is having superior connection to the body of the vertebra. Middle connection to the annulus fibrosus. There we will see this annulus fibrosus. If you see IVD, intervertebral disc, middle of portion is formed by the nucleus pulposus. Periphery, lateral portion surrounding nucleus pulposus is surrounded by the annulus fibrosus. So that here the radiate ligament which is present here, it is going to uptake, it is going to continue, or it is going to match with the annulus fibrosus of this intervertebral disc, and inferior portion is uptake with the inferior vertebra. So that here each costovertebral joint is having interosseous ligament and three portions of the radiate ligament. So because of the presence of the interosseous ligament and radiate ligament, here the joint stability is more. Because of more stability, here mobility is less. And one more point, here the two ligaments, intra-articular ligaments and radiate ligament, are inside the joint capsule. One joint capsule will surround the entire costovertebral joint. So these and all we are seeing in second to 9th ribs. Now if we come to first 10, 11, 12, here we will be having radiate ligament. Will be there, and interosseous ligament or intra-articular ligament is absent. There is no intra-articular ligament here. Why there is no intra-articular ligament means, here these ribs are going to articulate with the two ribs. These ribs are going to articulate with the two vertebral bodies. But here each rib is going to articulate with only one vertebra. So that's why there is no intra-articular ligament. So that here the stability is less compared to these joints. Because of less stability, mobility is more at the first 10, 11, 12 rib cage. So that's why whenever we are doing ventilation, the lower rib cage, this is 10, 11, 12, nothing but lower rib cage. So lower rib cage will move more compared to the upper and middle rib cage. The lower rib cage will move more because here mobility is more. Okay, and at the same time here also these joints will be having joint capsule. The joints also will be having joint capsule. So this is about the costovertebral joints. Clear?